NASH is non-alcoholic steatohepatitis, which is a condition where the liver has both fat, inflammation, and laying down of scar tissue or fibrosis. And there is increasing evidence that this condition can lead to hepatocellular carcinoma, predominantly through the formation of end-stage liver disease, or otherwise known as cirrhosis. So to put it in context, NASH is part of non-alcoholic fatty liver disease. The most benign end of the spectrum, which is non-alcoholic fatty liver disease, or NAFLD only, is weakly associated with the risk of hepatocellular carcinoma. Once you move to the more progressive lesion, which is NASH, the risk increases, and it's around 5% over 20 years of follow-up. If you go to the NASH-related cirrhosis, the risk is quite measurable. It's around 1% per year, and most experts at this point in time recommend routine surveillance for hepatocellular carcinoma among patients who have cirrhosis related to NASH. The knowledge about the association between NASH and HCC is quite rudimentary outside this specialist field. And the reason I say that, because the vast majority of hepatocellular carcinoma cases that get diagnosed and the underlying reason is NASH, prior to their diagnosis, most of them are not recognized to have cirrhosis, and almost all of them undergo no forms of routine surveillance at all. And that is highly disproportionate to the other causes of cirrhosis like Hep C and Hep B and alcohol, where the level of knowledge of the association between these risk factors and HCC is much greater. So yes, there needs to be a lot of increased awareness of the link between NASH-related cirrhosis and hepatocellular carcinoma, and that needs to be coupled with two things. One is prevention of the primary risk factors, which means detection and treatment, and the second one is increasing screening and surveillance in those who have that lesion to detect hepatocellular carcinoma at an early and thus treatable and potentially curable stage.